Herniation of a lumbar disc. Most lumbar disc herniation occur at the L4-5 or the L5 and S1 interspaces. That is lumbar and sacral. Lumbar 4 and 5 or the lumbar 5 and sacral 1 interspaces. A herniated lumbar disc produces low back pain accompanied by varying degrees of sensory and motor impairment. Clinical manifestations. The patient complains of low back pain with muscle spasms, followed by radiation of the pain into one hip and down into the leg, that is sciatica. Pain is aggravated by actions that increase intraspinal fluid pressure, bending, lifting, straining, as in sneezing and coughing too, and usually is relieved by bed rest. Usually there is some type of postural deformity because pain causes an alteration of the normal spinal mechanics. If the patient lies on the back and attempts to raise a leg in a straight position, pain radiates into the leg because this maneuver, called a straight leg raising test, stretches the sciatic nerve. Additional signs include muscle weakness, alterations in tendon reflexes, and sensory loss. Assessment and diagnostic findings. The diagnosis of lumbar disc disease is based on the history and physical findings and the use of imaging techniques such as MRI, CT, and myelography. Medical management. The objectives of treatment are to relieve pain, slow disease progression, and increase the patient's functional ability. Bed rest for 1 to 2 days on a firm mattresses to limit spinal flexion is encouraged to reduce the weight load and gravitational forces, thereby freeing the disc from stress. The patient is allowed to assume a comfortable position, usually a semi-fowler's position with moderate hip and knee flexion releases the back muscles. When the patient is in side-lying position, the pillow is placed between the legs. To get out of the bed, the patient lies on one side while pushing up to a sitting position. Because muscle spasm is prominent during the acute phase, muscle relaxants are used. NSAIDs, that is non-steroidal anti-inflammatory drugs, and systemic corticosteroids may be administered to counter the inflammation that usually occurs in the supporting tissue and the affected nerve roots. Moist heat and massage help to relax spastic muscles and have a sedative effect. Antidepressant agents appear to help in low back pain that is neuropathic in origin. Surgical management. In the lumbar region, surgical treatment includes lumbar disc excision through a posterolateral laminectomy and posterolateral laminotomy, and the newer techniques of microdissectomy and percutaneous dissectomy. In microdissectomy, an operating microscope is used to visualize the offending disc and compressed nerve roots. It permits a small incision 2.5 cm or 1 inch and a minimal blood loss and takes about 30 minutes of operating time. Generally, it involves a short hospital stay and the patient makes a rapid recovery. Percutaneous dissectomy is an alternative treatment for herniated intervertebral disc of the lumbar spine at the lumbar 4-5 level. One approach is current use is through 2.5 cm, that is 1 inch incision just above the iliac crest. The tube, trocar or cannula is inserted under X-ray guidance through the retroperitoneal space to the involved disc space. Special instruments are used to remove the disc. The operating time is about 15 minutes. Blood loss and postoperative pain are minimal and the patient is generally discharged within 2 days after surgery. The disadvantages of this procedure is possibility of damage to structures in the surgical pathway. Complications of disc surgery. The patient undergoing a disc procedure at one level of the vertebral column may have a degenerative process at other levels. A herniation relapse may occur at the same level of elsewhere, so that the patient may become a candidate for another disc procedure. Arachnoiditis, that is inflammation of the arachnoid membrane, may occur after surgery and after myelography. It involves an insidious onset of diffuse, frequently burning pain in the lower back, radiating into the buttocks. Disc excision can leave adhesions and scarring around the spinal nerves and dura, which then produce inflammatory changes that create chronic neuritis and neurofibrosis. Disc surgery may relieve pressure on the spinal nerves, but it does not reverse the effects of neural injury and scarring and the pain that results. Failed disc syndrome, recurrence of sciatica after lumbar discectomy, remains a common cause of disability. Thank you.